What's up guys, and welcome back to the channel. Now in this segment, we're going to go over something a little bit different, a little bit new, and even a little bit controversial. Why? Because it's probably going to hurt some feelings, but at the end of the day, I found an issue in the field and I'd like to try to make a difference. When we're trained in the beginning, we're told to bring our patients to the closest, most appropriate facility, right? Well, some of these patients are just going to the closest facility. And I want to go over what you see on the scene, what you should be thinking about for your transport destination, and if you don't bring them to the right facility, essentially what's going to happen with that patient afterwards. So stick around and stay tuned for Soapboxing with a Medic. Guys, so you finally get to the scene and we're talking about our judgment calls at first, right? Is the scene safe or is it not safe? How about our patient? Are they sick or not sick? And if they are sick, how sick are they? Are we talking about a chest pain patient? Respiratory distress? Do we ultimately already see trauma alert? STEMI? Sepsis? Stubbed toe? Are we talking about a pediatric? A geriatric? A bariatric? I mean guys, we have to think about all these things when it comes to treating the patient and ultimately the destination we're going to bring this patient to. Why? Because then we need to start talking about specialists and services that the facility might or might not have. This is where we're going to find out if they are a lazy medic or a patient advocate at the end of the day. Now guys, whether you are new to the field or new to the area, the biggest thing that you guys are going to have an issue with is knowing your facilities and knowing your area. Now you might have 5 hospitals in the area, you might have 12 hospitals in the area. But at the end of the day, not all hospitals are built the same and not all of them have the same services. So you need to become familiar with what facilities can take care of your cardiac patients, your neuro patients, your trauma patients, pediatric, whatever it might be. Because they're not all built the same. Some might just be a standalone ER that could just handle everyday boo-boos. Another one might be a teaching trauma center that's going to be able to handle everything. If you don't know what everything is in your area, that's okay. And even if your partner doesn't know, that's also okay. The way you can go around this is find out what facilities cover what. And you're going to make a cheat sheet for your truck that you can essentially look to the side and say, this facility can handle this patient. That way you're not thinking about it and you can go back to doing your patient care. Something that you have gone to school and been trained to do. Now, in addition to knowing your area, guys, you gotta know your patients, right? So let's start with the easiest demographics. Are they a pediatric? Are we geriatric? Is this a obstetrics we're talking about? Guys, all this plays a role into the care of your patient and the specialties that they're gonna need. The next thing we're gonna talk about is what their complaint is. Guys, is this a respiratory patient? Is this cardiac? Guys, if they say chest pain to you, you need to bring them to a facility that's able to take care of that. So sure, if you bring them to the standalone ER, the first thing that they're going to do is they're going to put a 12 lead on them. They're going to pull labs on them to find out what their troponin might be. Well, guess what? Even if everything's negative, they're still going to take them for observation for 24 hours. So obviously they can't stay in a standalone for that time. They're going to have to be transported out. So that's just another thing that patient's going to have to deal with. Like the most obvious everyday call that you run in any area, the ground level fall. You go to the nursing home and you got to transport these patients out, right? Well, if they're complaining of pain or LOC, you got to bring them to the right facility. They're going to need to get scans done. They're going to have to get x-rayed. Like this is all going to happen. It doesn't matter what it is at the end of the day. When it comes to all these patients, some of the more complex or the higher risk patients, you're going to have to get them checked out. And like I said with the chest pain patient, guys, this could simply just be a CYA thing for the physician because they don't want anything to happen to that patient and then be ultimately responsible, even if they feel completely comfortable with discharging them. It's just part of the medical field and something that we have to deal with. So again, guys, whether we're talking about stubbed toes or brain bleeds, we need to bring our patients to the correct facility that makes the most sense for them, right? Because at the end of the day, it is your job as a provider in the pre-hospital care to think ahead of time for what that patient's going to ultimately need. Now, whether a patient came in by you or by themselves, At the end of the day, they're going to be checked out at this and treated at this ER. And if a patient cannot be taken care of from there, they're probably going to get sent out, right? Well, let's start at the beginning. Your patient gets there. You give report. They realize that they're going to have to pull labs on this patient, maybe EKGs, maybe CT scans, X-rays, whatever it might be. So they're going to do all this work, and then the physician is going to examine everything and say, well, you know, we can send them home, cast it, or give them some antibiotics, whatever it is. But if it's anything more than that and they're going to need specialists or services or surgery, anything like that, now we're talking to another facility. We're talking to another cardiologist, neurologist, whatever it is. This takes time, guys. This takes hours. A patient can be sitting inside of an ER an entire day just because they need to get accepted to the new hospital, and then they need to get approved for the new hospital. Insurance has to run, all these things, and now they got to wait for a transport team. Well, guys, is this patient going to be just standard ALS? Are they BLS? Is this something they can get a truck there in no time? Are they going to have to call a transport unit such as my own, which is critical care? Now we're talking about bringing patients on vasoactive medications, on ventilators, whatever it is. Guys, we're not always available. We might be somewhere else. It might be, you know, hours before we can even get there. So depending on the call volume and what's going on in the area and how busy a service might be, this patient could be sitting there for an entire day. Why? Because if they were brought by an ambulance, this entire day could have been saved if they were just brought maybe 20 minutes farther down the road. It's just something we have to think about. And another thing that we have to think about, guys, are we even going to stay in the same company? Is this going to be the same hospitals, or do we have to go to an entirely separate hospital system? Well, guys, this could mean that a patient has to restart in an ER, and they have to re-get everything. And now we're talking about 2 major ER bills that a patient has to deal with. Are you going to pay that? No, of course you're not going to pay for that. That's not your ER visit. But now the patient's going to have to deal with that. So now they have 2 massive ER bills, and they spend an entire day inside of ERs dealing with the code blues and the beeping and the crazy patients, and just what the heck are we doing here, guys? Let's stop this from happening, and let's just bring our patient to the correct facility so they don't have to deal with this at the end of the day, right? All right, guys, scenario time. You get called out for a 24-year-old female. She was involved in a high-speed crash. She was an unrestrained driver, and she doesn't remember the crash, okay? And here are the pictures from that scene. Look them over. What do you see? I'll tell you, the major thing that I see here is a spiderweb windshield. This unrestrained driver clearly met contact with that windshield. Let's go ahead and talk to our patient. We open the door, we find them. They are there, they're cognitive. They don't remember the crash itself. They're complaining of severe left pain, a severe left leg pain, and they're complaining of right side abdominal pain. You look at them and you see a hematoma on their head at this time. On further examination of the patient, once you get them out of the truck or out of the car, you notice that they have a severely angulated left femur fracture. They also have ankle involvement. More than likely, this patient was bracing themselves at the time of impact, right? Well, these are some major injuries that we're talking about here, guys. You can lose up to 1 liter of blood off of 1 femur. These are things we have to think about. Where we're going to bring this patient. I can tell you this patient was brought to the wrong facility. Now, the facility they were brought to was the closest facility. It was a nice looking facility, great optics, very big. But they are not a trauma facility. They do not handle these kinds of situations. So what happens with this patient? Well, obviously they're rushed to the hospital. They are brought right into a room. They are given pain meds, and they are seen by a doctor. Doctor orders all the tests, gets full lab work, gets full tox screens, gets scans, x-rays, everything. Okay, so we're finding out what the issues are, but we can't treat them. So, what happens next, guys? Well, a transport team gets called. Transport team shows up. They look over everything. They look over all the lab work, all the x-rays. They're talking to the patient, getting a good idea of what's going on. They're talking with the family, making sure the family's aware of where they're going and what's going to be expected. And they are just, essentially every time you have a new provider in front of a patient, everything restarts. And we have to get a good idea of what we're dealing with at that time. So, this patient, whilst they needed to get to care and everything, they were delayed by 6 hours because this patient was brought to the closest facility, not the most appropriate. So, think about that next time you're in front of your patient and you're making the decision of where they're going to go. All right, guys, so bottom line, if you are the primary care provider on your truck and you are making the decisions as to what is best for your patient, well, let's make the decision that is in the best interest of our patient, okay? Now, I understand that you may have run all day, or this might be your third call after midnight. Whatever it is, at the end of the day, it is your job and your responsibility to assess your patients, to treat your patients, and to bring them to the correct facility that is going to be able to help them. Now, I understand that sometimes off of presentation alone, we don't know for sure. You can't say for sure that a patient's going to have this, that, or the other. However, with enough time, talking with your patients and understanding, at least do the best you can to assess your patient with your differential diagnosis. Make the best decision within the best interest of your patient for their care and where they're going to go. Granted, it might take you 15 minutes farther down the road and, you know, they might be busy or this, that, and the other. But we're not on your time here, guys. We're on your patient's time. So please, think about it the next time that you're working. Think about it the next time you're in front of your patients. And just be a patient advocate. That's really my biggest thing about this whole thing. I just want, I want what's in the best interest of every patient in healthcare. I know it's not the easiest thing sometimes. I know that it can be a burden, but right now this is not your worst day. Okay, this is their worst day. They called 911 for you. So, in the moment of craziness for them, be the person that's making the wise decision that's going to help them ultimately. Alright guys, thank you once again for coming out to the channel and checking out the new video. This is the first of this segment, but I do plan to make quite a few more. So, if you have any questions about this subject or any others that you see as issues in the field, please drop a comment and let me know about it. I would love to talk with you about any of these subjects. If you are new here, please don't forget to like and subscribe to the channel and drop in alerts as well. That way you know every time that I drop a new video. At the end of the day, thank you guys for coming out and thank you for being a part of Soapboxing with a Medic.